Good evening, everyone. Welcome to our first forum of 2025. My name is Betty Kolod. I'm an internist, preventive medicine, and drug user health physician, and I'm chair of the Board of Physicians for a National Health Program New York Metro chapter. Please go ahead and introduce yourself in the chat with your name, pronouns, and location. The chat can be opened by clicking on the chat icon in your Zoom toolbar, which is usually found on the bottom of your screen. We are recording this session, and we will share by email to everyone who RSVP'd a modified recording, and that will be modified based on our panelists' requests. You can access closed captions by clicking the closed caption icon in your Zoom toolbar, available in English and many other languages, and we will list that in the chat. Everyone is muted right now. We will be having a Q&A session following the discussion, so please put your questions and any comments in the chat by clicking on those buttons in the Zoom toolbar, and we will read and answer your questions during the Q&A portion of the program. Please feel free to post on social media about things you learned tonight and to follow and tag us. All right, so we will now open a poll. We always like to see who's in the room. So in just a moment, you should be seeing our poll. And as that goes up, just want to do an introduction to our chapter for anyone who is new. Okay, great. So Physicians for a National Health Program New York Metro chapter works for health justice by building the movement for universal, single-payer, publicly financed healthcare for all. At the state level, we play an active role in the Campaign for New York Health, the statewide coalition organizing to pass the New York Health Act. On a national level, we support efforts to create an improved Medicare for All program and to resist attempts to further privatize our public healthcare programs, Medicare and Medicaid. Information on our upcoming events and ways to get involved are at the website, our website, www.pnhpnymetro.org. To support our work, including our free monthly public forums like this one, please consider making a donation to our chapter, and you will find a link in the chat. Okay, so let's see who's in the room. All right, so based on responses so far, we have a nice diversity of health workers, union members, and of course, we are all patients. Thank you so much for sharing. And great to see intros continuing in the chat. All right, before we get started, just want to let you know our next forum will be on February 18th at 7:30 p.m. here on Zoom, and we will explore pandemic preparedness as COVID-19 continues to circulate, disable, and claim lives, and H5N1 bird flu is an increasing concern. And also as our national health agencies are barred from communicating with the public at the moment. All right, and you'll see that information in the chat. And please save the date and RSVP for our health worker, resident, student, and advocate lobby day to pass the New York Health Act. That will be on Tuesday, March 18th. So check out that link in the chat. There's a lot more information to come on training and getting on the bus going up to Albany. We have many more events and actions in the works, so make sure that you're on our listserv and keeping an eye on your inbox to stay up to date. All right, so next, we'll move on to our land acknowledgement. We are hosting this event from New York, and we acknowledge that the land on which we are based is the traditional and unceded territory of the Wappinger, Munsee, Lenape, Canarsie, and Rockaway people. The theft of this land, which is both historical and continuing, along with the stolen blood and labor of enslaved Africans, enable our presence. All institutions, our healthcare system, and the nation state itself were founded on and continue to enact exclusions and erasures of Indigenous peoples. This acknowledgement demonstrates a commitment to beginning the process of working to dismantle ongoing practices and legacies of settler colonialism. We pay our respects to Indigenous, African, and immigrant elders past, present, and future who have stewarded this land, and particularly to the hundreds of Indigenous nations who continue to resist, live, and uphold their sacred relations across our lands. This acknowledgement, while neither sufficient nor complete, must become a part of a larger process of learning and action. All right, let's turn to our topic for this evening. Over the past week, the new presidential administration has introduced a barrage of executive actions that, if upheld, would have sweeping consequences for healthcare access, public health, and scientific research. This evening, we will examine some of these measures and their implications here in New York, particularly on populations experiencing long-standing and intersectional marginalization from healthcare. This administration threatens to roll back Affordable Care Act subsidies, threaten the open enrollment and shorten the open enrollment period, and severely restrict Medicaid. These actions threaten the health coverage of tens of millions of Americans, particularly the people who are already struggling to access health care. Additionally, we see attempts to halt programs to lower drug costs for Medicare and Medicaid recipients, further compounding economic and health hardships for our most vulnerable neighbors. In public health, we are alarmed by withdrawal from the WHO, jeopardizing global health programs for tuberculosis, HIV, and emerging pandemics. And we are all harmed by muzzling of HHS agencies and essential diversity, equity, and inclusion programs. Yet amidst these threats, we must not let dangerous and in many cases illegal actions sow chaos and confusion. Now more than ever, we must stay focused on the long arc of organizing for health justice. This moment calls for unity, resilience, and a recommitment to protecting the right to healthcare for all. We know that sustained collective action is more important than ever, and we must keep our eyes on our health justice goals, regardless of these terrifying minute-by-minute developments. As we move forward in this webinar, we'll delve deeper into the implications of these policies and explore strategies to resist, advocate, and continue building a movement for equitable and just healthcare. So let's move on to our fantastic panel. All right, so I will introduce the entire panel before we go into our first presentation. First, we will hear from Elisabeth Ryden Benjamin. She uses she, her pronouns. She is the Vice President of Health Initiatives at the Community Service Society, where she supervises health policy, health advocacy, and consumer health assistance programs, including the Community Service Society Navigator Network, Community Health Advocates, Independent Consumer Advocacy Network, the Harlem Health Advocates Project, and the Small Business Assistance Program. Collectively, these programs help over 100,000 New Yorkers each year enroll in or use health insurance or access low-cost health care. She's a co-founder of Healthcare for All New York, or HCFANY, a statewide coalition of over 170 organizations devoted to securing affordable, quality health care for all New Yorkers. Ms. Benjamin has a Juris Doctor degree from Columbia University School of Law and a Master of Science degree in Health Policy and Management from Harvard School of Public Health. Next, we will hear from Mateo Guerrero-Tabares, who uses he and they pronouns. He is the Trans Justice and Leadership Program Manager at Make the Road New York, where he runs the Leadership School Program, develops movement curricula for liberation, and supports organizing spaces for transgender, gender nonconforming, intersex, and queer community members. Mateo's work is informed by his identities as a transgender man of color and a queer, formerly undocumented migrant. Mateo organizes at the intersection of ending criminalization and detention for immigrant communities and demanding protections for transgender, gender nonconforming, intersex, and queer communities of color and people in the sex trades. And finally, we will hear from Dr. Diljeet Singh, who uses she, her pronouns. She is a women's health advocate, an integrative gynecologist oncologist, and the incoming president of Physicians for a National Health Program. Dr. Singh received her medical degree from Northwestern University and her master's degree from the Harvard School of Public Health. She completed an obstetrics and gynecology residency at Johns Hopkins and a gynecologic oncology fellowship at the MD Anderson Cancer Center. She completed her doctoral degree in public health on cost analysis at the University of Texas School of Public Health and an associate fellowship in integrative medicine at the University of Arizona. Let's welcome Elisabeth Benjamin.
Hi, everybody. It's really just such a huge honor to be here tonight, and I really, really appreciate the invitation. I have a lot of slides, but I'm going to go through them quickly. But we can always, go back to anything that doesn't make sense to you all in the Q&A. So I'm just sharing my screen here. I'm doing that thing. Hopefully, are you seeing duplicate? This is the one little tricky thing, or is it single?
Looks great.
Fantastic.
Okay, great. All right, so just to remind you all, I'm really focusing on New York, but obviously today's been a really busy day. My entire organization freaked out, but it's all gonna be okay. And I think that's a big part of, we have to get mad and mobilize and organize, but we can't be we have to react with, the lawyers when a dumb thing happens like today, but we'll get to that. Anyway, we'll get to that in the Q&A process. But just to remind you all about New York Medicaid and public insurance in New York, because it's much more than Medicaid. Right now, we have about 7 million people enrolled, just under 7 million people enrolled in Medicaid in New York, of which 1.8 million are in the Affordable Care Expansion program, which I'll explain later why that's significant. We also have another 1.5 million that have essential plan coverage through a 1332 waiver. That's important. And then we have people enrolled in our Affordable Care Act marketplace, and that's around 225,000 people, of which 153,000 are getting enhanced tax credits, which are on the chopping block. So just Medicaid in New York, the upstate has a little less than, like 40% of the folks have Medicaid. Upstate, 60% of Medicaid programs. The pie is 60% downstate, 40% upstate, roughly. Just to remind you all, about 28% of New Yorkers are covered by Medicaid. And it's, lots of people. It's working people. It's seniors. It's people with disabilities. It's kids. So in most states, there is a matching rate where the federal government supports the Medicaid program. In New York State, we have the absolute lowest matching rate, which is a 50% matching rate. A lot of other states have bigger ones, and we'll come to that, back to that. But and then this is just sort of a visual of who is, who has Medicaid in New York. 1 in 4 adults, 5 in 8 nursing home residents, 2 in 7 Medicaid beneficiaries, 4 in 9 people with disabilities. So, as you can see on this map, New York is one of the light blue states, which means we have the lowest possible matching rate of 50%. For every Medicaid dollar we get, we put up in state tax levy, another dollar is put up in the federal government. If you're in Mississippi, Alabama, Louisiana, that rate is you only have to put up 30 cents for every dollar. So it's the red states and a lot of other states have much more generous matching rates. I wanted to talk about the prominent conservative plans. So the goal for the conservatives is essentially they want to recover $7.5 trillion, of which 31% they want to get out of Medicaid. So it's quite substantial. 2.3 trillion out of Medicaid over 10 years, nearly a third of all the projected Medicaid spending that we currently have. They want to get another 151 billion out of the Affordable Care Act and about 497 billion out of Medicare. So Medicaid, it matters. The most prominent proposals as of now are, remember that matching rate where New York has a 50% matching rate? They want to make it even lower. So they're saying maybe New York should only get a 30% federal matching rate, in which case that would cost our state about $10.3 billion and really threaten over 5 million people. Well, actually, probably, 5 million people in the traditional Medicaid group. They also said, oh, wait, that expansion program group of the other, so it's 5 million plus another 1.8 million that are in the expansion group. Those people actually get a 90% matching fund. We want to get rid of that and drop that down to 50%. That's another $4.43 billion a year. And then they have these other great ideas like block granting or doing per capita caps. And we can talk some more about those options in the, I think it'd be better to, because I don't want to take my other colleagues' time up. I'm just going to talk about that in Q&A. But let's just talk about what it means. If the state gets a $4 billion, $5 billion, $10 billion cut to its Medicaid funding, that means they're going to either have to dramatically raise taxes, cut other parts of the state budget, of which Medicaid is still the largest, so that's the K through 12 of education, or institute deep, deep, deep cuts to the Medicaid program. So one thing they could do is just drop the expansion program. That's 2 million people. Another thing they could do is just cut people in nursing home. Oh, we could cut the rates. We could cut how much we pay providers, which already they feel that they're being underpaid. Or we could do really bad things like say, oh, we're just not going to pay for cancer treatment or physical therapy or something else. Or we could go after immigrants. That's always a favorite too. But I think one of my colleagues will be talking about that. So this is homework for later. It just says there's like 3 different conservative plans. There's the Project 2025, there's the Republican Study Group, and then there's this House Budget Committee resolution. And then there's another one, which is the House Ways and Means document that just started circulating this last week. They got lots of plans. It's all bad. And this is just for later. On the tax credits, the goal is to cut Medicaid and to cut the tax credits to pay for what? It's to pay for tax cuts for the rich. Let's not, Elon Musk definitely needs another private jet. He definitely needs mahogany floors on his yachts. I mean, like, what are they going to do with all this money? They are getting so much already. They already pay such low taxes, but they want more tax cuts. One of the things that's a problem for us here in New York State is there is one tax that really does help middle income people and moderate income people, which is the state and local tax. It's called the SALT tax. That's $12 billion a year. They want to add that to sweeten the pot for our swing congressmen. We can talk more about this in the discussion part, but that makes it harder for us when we're going to our members of Congress saying, look, we know you think your job is to go get the SALT taxes, but not at the point, not in exchange for throwing grandma out of the nursing home, not in exchange for, not having people with disabilities access to health coverage or children or low wage working people. And this just sort of is the list of, here's the DACA, for example, another thing they could do that's on the chopping blocks. I'm not sure what my colleague from Make the Road's going to talk about, but right now we have DACA subsidies. They might want to get rid of that. That's just $6 billion around the country, but it's something. So the other thing that we have that I want on everybody's radar is we have, there's 20 million people around the country that get financial assistance called advanced premium tax credits for being able to buy Obamacare, right? Or Affordable Care Act coverage. On top of that, in the Inflation Reduction Act, they actually made them more generous. They were very stingy, the original batch of tax credits. If they get rid of the enhanced premium tax credits, we think 4 million people will become uninsured right away because it'd just be too expensive for them. So for New York, we had 200,000 people getting APTCs. Without APTCs, their premiums could go up to $714. If we get rid of the tax credits, it's going to mean $1,400 more per person. So it's bad. We don't want that. We have to organize probably more towards the end of the year, unless they somehow toss this into the reconciliation package, which I don't think they would. The other thing that makes us a little vulnerable is we have one of these federal waivers that deal was finalized. It's not supposed to expire until 2029, which is conveniently when we'll have President Vance and not President Trump. We can hope that President Vance will be like a kinder, gentler guy, or maybe we'll have some Democrat that will preserve our 1332 waiver. It's really important. It covers our, which is what I know this is a bad word around here, but it's our public option. It's really, for the people who have it, they really love it. It's it's a public coverage with zero deductible, very low cost sharing. It's a 1332 waiver. We call it Essential Plan. It's great coverage. For those who have it, they're really happy about it. I worked really hard to get this plan in New York State. And I know it's not what we really want, which is just, Medicare for all, but it's definitely a stairway to Medicare for all. And, it generates about $10 billion a year, of which we can get up $1 billion surplus. So we really don't want them to go backsies on this waiver. That would be very bad for our folks. And so I don't think they will, but who would have thought that OMB was going to issue something last night saying you're not going to pay any of your bills. So we can talk about that in the discussion. Thank you so much for giving me a little time to speak with you all. I hope that was helpful.
Thank you so much. Thanks for covering so much information, and we'll definitely dig into that in the Q&A. All right, so next I will pass it to Mateo.
Awesome. Thank you so much. Let me share my screen. Second. Okay, are folks able to see my screen?
Yeah, it looks great.
Okay, well, thank you so much, Elisabeth, for that presentation. I think there's a lot of feelings of nervousness and fear, but also the desire to organize and push back and fight back. So this part of the conversation, it's going to be not just health aspect as check-ins with doctors and that type of legislation, but rather other social determinants for health. We're going to talk about housing. We're going to talk about access to representation and what are some of the bills at the state level that we're trying to push for. And so Make to Run New York, we have a platform that we're pushing for this legislative session. It's called Protect Our Futures. And this platform, it's in an effort to fight against the Trump's agenda of hate and the demonization of migrant communities. One of the bills that we have been fighting for a long time has been Coverage for All. We just reintroduced it in the Assembly, and we have a pending number for the Senate. This will extend the essential plan for low-income New Yorkers who meet the income requirements. We passed a version of this. You all are familiar with it. For folks who are carrying pregnancies and for folks who are over 65 years old. And we've been trying to close this gap for undocumented folks between 19 and 65. Now, right now, at the moment, based on what Elisabeth has been sharing, the focus is going to be on ensuring that immigrants don't lose access to certain benefits that they currently have. So, for example, DACA folks and TPS recipients, we want to make sure that they still retain access to the essential plan and Medicaid. So our fight is going to be focused in protecting what is already accessible to migrant communities. Now, there are other bills that are a part of our state platform. One of them is New York for All. One of the things that we want to make sure is that New Yorkers know that there is no communication between local authorities and that they will not be cooperating with ICE. So this bill that was introduced by Guerrero-Tabares in the Senate and by Ryden in the Assembly, what it does is that it prohibits communication and enforcement from local agencies and communication with ICE custody. This is very important, particularly as we have heard about the new executive orders for expedited removals, as we have heard about the increase of rates that have been happening over the past few days and this weekend, yesterday, Monday, where we saw 1,100 rates that happen across the United States. We want to make sure that New York State is one that protects immigrant communities from being pushed into ICE custody. And one of the things that I want to mention is this particular bill will protect all community members. There are areas where there is tremendous increase of policing. We have Major Eric Adams that has been doing an operation in Roosevelt called Operation Restore Roosevelt, where There have been hundreds of cops arresting and ticketing immigrant communities for doing sex work or for being street vendors. And so we want to make sure that we reduce police presence, but also if there is any arrest or any interaction with the police, that community members are not being funneled into detention. Another bill that we're pushing for is access to representation. And so unlike criminal cases where there's an attorney that is assigned for people to represent them in court, it doesn't happen for immigrant communities. So oftentimes migrants are forced to represent themselves in immigration court, or they look for support for a community organization. Right now, there is very limited resources. And so what we're saying is that New York State needs to make sure that we have access to representation for migrant communities to go to do their immigration court proceedings. This will increase the ability to stay in New York, to stay with their families and their communities up to 10 more times than without representation. Another bill that we're fighting for is housing access voucher program. We know that without housing, people are not going to be able to take care of their health, whether it be physical health or mental health. And so what this proposal is to allocate $250 million annually for housing vouchers. 50% will go to households that are at risk of being unhoused, and the other 50% will go for unhoused individuals. This particular housing access voucher program is also available for people regardless of their immigration status, people who have had prior interactions with the criminal legal system, and people who cannot access other forms of housing programs. And then how are we going to do this? There is a package of legislation called Invest in Our New York. Elisabeth also talked about this earlier, but Trump is making sure that more tax cuts are happening for the rich. And what we're saying here is New York State has to tax these people, has to tax the rich people, has to make sure that we generate funds from the richest of the richest here in New York State. There are multiple bills in this package of Invest in Our New York. It will propose increasing corporate taxes on large multinational corporations with profits greater than 2.5 million. It seeks to create new tax brackets for high incomes, more than 450,000 per year. It implements a surcharge on capital gains income for those earning more than 400,000. It proposes a tax on the increase in the value of shares and investments for billionaires. It replaces the New York State tax with a heirs tax on states over 250,000. There's another bill that we're fighting for that is very important. I work on with the Trans Immigrant Project, and one of the bills that we're holding at the state level is Cecilia's Act for Rights in the Sex Trades. It used to be known as Stop Violence in the Sex Trades Act before. Now it's called Cecilia's Act to honor Cecilia Gentili, who was a trans advocate, a health advocate who passed away last year. And this legislation will decriminalize sex work in the sense of decriminalize the exchange of money, resources for consenting adults. None of the penal codes regarding minors or sex trafficking are changed. They remain the same. And we're doing this because we understand that when a trans person is arrested, is put through jail, and they're immigrant, it is likely that they're going to put in detention and deportation. Melissa Nunez, one of our members, she was deported to Honduras in 2022. And as we were fighting to bring her back, she was killed in Honduras. And so legislations like this, Cecilia's Act, is to protect sex workers, to make sure that they also are able to remain with their communities, to have access to housing, to healthcare, to all these things to remain alive. And so these are some of the bills that we're fighting for. One of the things that I wanted to also mention for folks who want to get plugged into this work or want to know more about trainings on how to respond if there is an ICE raid, we are having trainings on Know Your Rights. These are just the ones for this week, but we're gonna have many more for the years to come. And so the 29th, we have one in McDermott, Brooklyn. On the 31st, we have one in Staten Island. We have one also as well in Long Island, the McDermott offices. And then on the 6th of February, Next week, we're going to have one on Make the Road Queens. If you're unable to attend these trainings, but you want to check in, like learn about your rights, you can click on this QR code. It will take you to our deportation defense manual. We have it in English and in Spanish. Share it with your families, with your friends. And then calls to action, a couple of things very quick. We want to make sure that to urge public and private hospitals to, one, commit to keeping information confidential for migrant communities, making sure that ICE is not allowed in their facilities, and to continue to support organizations like Make the Road that are doing work on the ground, whether it be by going in and supporting with facilitating workshops, or going to marches, going to protests, going to Albany, or donating to organizations like Make the Road. I wanted to just quickly show a video. I know there's a lot of hard feelings and feelings of defeat, but this is a march that we had recently, and I wanted to close with this video to remind us that we've got each other, that we're going to continue to organize, and that if we stay together in this moment, we're going to be able to fight against this agenda of hate.
You feel in your belly and in your chest continues to inspire you to come out and fight for liberation and fight for our freedom and fight for our futures. Se ve, se siente. El pueblo está presente. Se ve, se siente. El pueblo está presente. Se ve y se escucha. El pueblo está en la lucha. Se ve y se escucha. El pueblo está en la lucha. So everywhere we go, people wanna know who we are. So we tell them, we are the immigrants, the mighty, mighty immigrants, fighting for justice, and our family, give it up, give it up.
It is our duty to fight for our freedom.
It is our duty to fight for our freedom.
We must love and support each other.
We must love and support each other.
We have nothing to lose but our chains.
We have nothing to lose but our chains.
We have nothing to lose but our chains.
We have nothing to lose but our chains. We'll keep on organizing, and here's more information about our state platform in case people want to get more familiar with it. Thank you so much.
Thank you so much, Mateo. Thank you for activating us to get organized, stay organized, and it's really an honor to work alongside Make the Road New York to fight for the New York Health Act and all of these priorities that affect the health of our communities. All right, next let's hear from Dr. Diljeet Singh.
Hey, everybody. I'm going to take a sec to just get my PowerPoint. And that was tough, Mateo, tough following you. But I'm going to try. So I'm going to take a little bit of time to, well, thank you. And just my honor to join New York Metro's PNHP. I have some people I've known a long time. Some are new to me, and just started my time in the president's office of PNHP, and hopefully we'll have some time to get to know you all, some of the new faces, and some time in the Q&A to chat some. So just going to take a few minutes to talk a little bit about PNHP's thoughts for the upcoming year and our current strategy, understanding that it will evolve as you guys are seeing stuff coming out every day. We'll keep evolving with all of you. So thinking about what we're describing as our triple aim, right? We always focus on single payer, the concept of universal health care, covering everybody, free of copays, free of deductibles. but realizing that we have some tools that can help us spread the message and maybe gain other followers. I'm sure some of you didn't come to this from the universal healthcare path, but the idea of ending profiteering and how capitalism impacts so many aspects of our society, but specifically healthcare. And then, of course, focusing on improving traditional Medicare as a way to broaden the base of our healthcare allies. So thinking about this window that we have right now, where people are finally realizing the deep flaws of Medicare disadvantage, and the challenges of taking one of our most valued public programs and giving it away and giving away our healthcare dollars. If we want to think about where to take back trillions, maybe it shouldn't be Medicaid, maybe it should be the profit, right, that goes to those organizations. Seems rather straightforward. But even the things that we can work on, you know, in a very nitty-gritty way to improve traditional Medicare, right? Get rid of the out-of-pocket maximums. Think about the things currently that limit people's access to traditional Medicare and why so many organizations, so many unions, so many pension plans are kind of going into this direction of Medicare Advantage because it feels more affordable. Of course, understanding, right? Everything is about getting universal health care. And these slides are way over my head. Ed Weisbart, our guy, makes these very action slides. I'm not always very action oriented, but thinking about like, what are our boundaries to achieving those things? Building power, building people power for us in PNHP, thinking about membership, thinking about fundraising, but also building our legislative relationships. And then for so many of you here, thinking about our allies, thinking about other people who are sharing our fight. Oops, sorry, I just lost my view of my own slides. I don't know how I did that. Can you guys see my slides?
Yeah,
Yes, we
still
still
looks
can.
good.
Yes.
I'm the only one who can't. I have kind of weird internet tonight at my house. Let's see. No, I just see me, not my slides. I know, I'm just old enough that I think I'm still allowed to have technical difficulties.
If you hit escape, you might be able to restart them, if that would
That's a
help.
good idea. No, that didn't work. Hmm. Now you guys can't see him. Now can you see him?
Yep,
Yeah,
they're
looks
back.
good.
Okay, sorry about that. My wasted 30 seconds. I swear I'll give them back by talking fast, something I can always do. So just, you know, our specific projects plans, I'm happy to get into the details about any of these, kind of where we're working on now. We have a moral injury project that I'll spend a little time talking about. Currently, we're working on a health equity report that's also been funded by philanthropy, and the goal is to focus on the health inequities that we find and are being amplified by the financialization of our healthcare. And a big part of that will be making some legislative visits, hopefully in November, and we're hoping people can join us in those things. Coming up, as soon as Dr. Oz gets his hearing, we're planning a Dr. Oz shadow hearing. And we'll talk about that later in some of our actions, but also continuing our work on this Medicare Advantage plan, other aspects of our work. And then just, you know, we have some of our SNAP members on the call, the goal to continue working with them. And then continue our coalition building. You know, Ashley, one of your all's members, also works on the reproductive justice interest group within PHP, thinking about, you know, as Mateo was talking, it was occurring to me that, you know, not only are immigrants' medical records not private, women's medical records are not private when it comes to reproductive health care needs. These are some of the allies that we have worked with nationally and that are working with us on both single payer and on the Medicare Disadvantage campaign. And then if we have a few minutes, I wanted to just talk really quickly about the Moral Injury Project, because I think it offers another way and another window into healthcare, and how we talk about it. We have a project funded currently by the Robert Wood Johnson Foundation, who is focusing on exploring the structural racism within healthcare. And we're funded through that, looking at how financialization, corporatization, privatization in healthcare is causing moral distress and injury among physicians, basically because physicians know we can't do the right thing for our patients. These are just some quotations from, we did some focus groups to start out, and we use these later, but thinking about physicians saying the profession has been taken over, ruined, decimated. We are all complicit in a racist system. That's the dirty part. Physicians talking about feeling exhausted, helpless, useless. The current role is unsustainable for me. One of the things that's come up over and over, both in our focus groups and now in our surveys, people talk about having to do more with less time, less support staff, more patients. And then these, like, all the complexities of when you have a completely profit-driven system where, the idea that someone comes in and it's a preventive care visit, so they can't talk about any symptoms. So one of our docs talking about having to hide clinical information that isn't preventive care, so a patient doesn't get double billed. I'll let you all keep reading those, and y'all will have access to the slides. And so sort of thinking about the idea that we have allowed healthcare to be taken, not any longer as an actual social good and turned into a pure commodity in our country. And that, you would think, this whole concept of moral injury, well, I'll talk about this first. But it's this issue of professional versus corporate ethics, right? And you can think about that however you want. To me, I think about the concept that corporate ethics have no place in healthcare, because professional ethics, the concept of we have sanctity in patient-physician relationships, right? Medical records should be private and should not be part of our carceral systems. The idea that patients trust us to put their best interests first, and that's the very basis of the relationship. But if you bring this conflict of interest in, of financial goals, you lose that. And then, of course, this complete loss of autonomy that we see, right? Where you can't say how much time you want to give a patient. You can't make decisions about what you think the best tools are for taking care of someone. And, when I first heard this term moral injury, the first thought I had was like, yeah, that's what I'm feeling. And then the second thought I had was, wow, if we have to take terms from warfare and military contexts and put them into healthcare, what does that mean? Why does that just not send us all lighting on fire? And I give a lot of credit to Wendy Dean, who's a psychiatrist who first kind of really pushed forward her working with Simon Talbot, this idea, and how she defines moral injury in healthcare, I think is really meaningful and something we should talk about. Moral injury is a sense that clinicians know what their patients need and they cannot get it for them because of the constraints outside of their control. And what that does is it causes us to wonder whether we can be the doctors that we thought we could be. And I always find it interesting, I've read this quote a million times, how she starts out talking about they, and she slides right into we. And in some ways that, to me, exemplifies, we almost set it apart, as opposed to saying, nope, this is our profession. This is our calling that is being destroyed. I'm just gonna, for one quick little slide, talk about OBGYN, because I think it truly is this case study for violating all of the principles of being a medical professional, right? The sanctity of the patient-physician relationship, the loss of autonomy, when the government can literally tell us that we have to tell people who come to us in a time of need, and we tell them things that are medically inaccurate, right? And then this issue that's already come up earlier of medical records being used by our carceral system, and thinking about things like fetal assault, homicide, and now, of course, when abortion is illegal, limiting the relationships between patient physicians. I think this is all I've got. I know we were gonna swear, oops, I'm gonna go back, because I think, Morgan, this was the beginning of our Q&A or our call to actions. This is, I think, mostly about the Moral Injury Project. And I do have on here, if there's any physicians on the call who have not taken our survey, to please take the Moral Injury Survey and then to spread it among your colleagues. And then I'm going to stop sharing so we can take questions from the group. And Betty, I'm assuming that's your forte here.
Thank you so much. Thanks for keeping our eyes on the prize, and really keeping us from getting distracted by all the chaos that's been unfolding over the past few days. All right, so let's move into the Q&A portion of our program. So continue to put your questions in the chat and we can get started. So we had a few different questions about the 1332 waiver. So Elisabeth, if you could talk more about the details of our 1332 waiver, and whether that, one of the questions was, does the 1332 waiver mean that New York receives federal money for Medicaid directly, and can choose how it spends that money, or what exactly does our 1332 waiver contain?
Sure. I'm sorry if that wasn't confusing. So our public insurance is like a patchwork of 3 programs. Well, actually 4. If you count, there's also a children's health insurance program for kids that are not eligible for Medicaid. And that's just for children 0 to 19. And there's no immigration bar. Anybody can enroll, and it's on a sliding fee scale. And even people above 400% of poverty can get this pretty inexpensive but high quality. It's commercial insurance. The second program is Medicaid, and we know that covers older people, people with disabilities, working, low-income people. Our original Medicaid program really went up to 87% of poverty, which is where it was for years for older people and disabled people. Now it's uniformly goes to 138% of poverty. So, and then with a little higher eligibility for kids and pregnant women. And so but rule of thumb around 138% of poverty with a couple of exceptions. The next program is called the Essential Plan. This is tricky now. It goes from 0, well, it really goes from 0 to 138% of poverty for people who are lawfully present, but ineligible for federal Medicaid funding because of federal immigration rules. So that's around 600,000 people, or well, back in the day it was. And then for people, everybody up to 250% of poverty. And that's that Essential Plan, no deductible. That's funded through the 1332 program. Medicaid's covered through Medicaid, which is a federal state matching program. And then there's the last program that goes for most people between 250 all the way up to whatever. It's got a kind of a drop down in subsidies that are paid in advance premium tax credits. There's financial assistance for people above 250% of poverty. And that's to go into a qualified health plan through the ACA marketplace, which we call New York State of Health in New York. 4 programs. So let's go back to the Essential Plan. The Essential Plan is funded by Section 1332 of the Affordable Care Act, which is called a State Innovation Program. And it is the successor to a program you guys probably heard me talking about, which was our basic health plan, which was 1331 of the Affordable Care Act. We put that one in pause and said, wait, we can get even more federal matching funds and maybe do even more crazy and great things for New Yorkers, like really buy down deductibles for people above income and 250% of poverty. So New York has been great. We figured out a really good way to use this provision of the Affordable Care Act to provide amazing coverage, free, no deductible, tiny copays for people up to 250% of poverty who are not eligible for Medicaid. And PS, we're also providing that to our DACA immigrant folks, all lawfully present plus the DACA folks. And then there's like three tiny categories of people who are permanently residing under color of law that we don't have in that program. But anyway, so, and they're often older than 65. So there's an age rule around the essential plan. So it's super confusing, but under the essential plan, we basically get what we would have gotten in premium tax credits and cost sharing reductions for those people. And then we put them in essential plan coverage, which is cheaper than our commercial insurance rate, which is so much higher. And that's why it works out to be this incredible windfall for New York. Too hard? I tried to kind of break it down.
Thank you so much.
Did that answer I didn't see the questions in the chat. I don't even see the questions in the chat.
Oh, so yeah, the question was about what the 1332 waiver covers. So,
Okay.
I mean, covers the essential plan. So like you said before, it covers our public option and it covers access to care for people who don't otherwise have access to our Medicaid plan because of their immigration status.
Okay, great.
Yeah. Okay, thank you. And then we had another question, and I might tackle this one and then pass it to anyone else who has an answer. So how would cuts in federal Medicaid funding affect potential funding for the New York Health Act? So as many of you know, the way that the New York Health Act would be financed is that it would pull down ideally, we would have federal waivers to pull down our federal Medicaid dollars, Affordable Care Act dollars, other federal programs that fund healthcare in New York into one pot together with our tax revenue for the New York Health Act, and that would finance healthcare for all New Yorkers, high quality, comprehensive healthcare for all New Yorkers. But analyses of the New York Health Act suggest that even if we could not get those federal waivers, the New York Health Plan would still be solvent just with our tax revenue. And so we wouldn't save the expected $12 to $17 billion each year compared to what we're currently spending, but we would still be able to provide healthcare, vision, dental, hearing, long-term care for all New Yorkers. All right, so the next question is there a risk of funding being pulled or funding being threatened to the NYC Care program, which takes care of many low-income and undocumented folks in New York City at health and hospitals?
Well, I mean, I'd love to ask our mayor that, but while all of our residents are being deported, like a group, I mean, I'm sorry, Mateo, you should probably answer this, but like, while our residents are being deported, he's, laid up with a headache. I mean, I don't get it. Like, I would like to think that I feel that Health and Hospitals and Dr. Katz are very committed to this program. And I feel that many people in the administration are committed to this program. I am concerned, and I really would defer to Mateo on this, but maybe I would like to, I don't want to put him on in a spot, but I mean, I am concerned that our mayor has not been speaking up as strongly as possible on behalf of undocumented immigrants who are eligible for that program. And, I would like to think he would continue to support it, but I'm worried about it. If we don't have, if all the federal tax cuts go into impact in the way that, if all the revenue streams, federal revenue streams going into our state and city get cut in the way that they're talking about, there's not going to be a lot of money to do much of anything. I mean, I don't know how the subways are going to run. I mean, it's going to be really tough. Mateo, I'm sorry. I think maybe you should have answered that question.
Yeah, Mateo, would you like to add anything about NYC Care?
No, I think we're still trying to figure out, like, we're going to continue the advocacy, but I think that was a very complete answer.
Okay, thank you. All right. Okay, so next question on New York for All. Is there something else in the works that might protect transgender people from being excluded from health care or healthcare professionals having to provide medically incorrect information about gender or sex. I don't know if that question was completely clear. But yeah, Mateo, could you address whether there are any other protections for transgender New Yorkers receiving healthcare?
Yeah, and so legislative session, we passed the Safe Havens bills, which is for folks who are trying to access gender affirming care from other states to be able to come here and have access to that. So we've been passing proactive legislation to protect people's ability to continue with their gender affirming care. We also passed Prop 1 last year, which will also ban discrimination based on gender identity, sex, etc. So this will also translate to the healthcare aspect. Right now, we have a couple of bills for a medical shield for information being shared about people's identities, people's ability to carry a pregnancy, etc. So there's a couple more legislations I can, at the end of this webinar, I can send a list of other bills that are helpful for trans folks. I think one thing that I want to mention that is not directly related to like healthcare bills, but one that is really important is called GERDS, which is a bill to allow for folks to be housed with their gender identity that they that represents them best at the state level. So you all heard about the executive order that says that there's only 2 sexes for federal as well as for immigration detention. Folks will be housed incorrectly according to that or executive order is being challenged right now. So hopefully there will be a halt on that executive order. But at the state level, there's also a legislation to protect against that executive order, which is called GERDS. It's a Gender Recognition Act, and that is for folks who are incarcerated. So I can send a list of other legislations, but yeah, those are some.
Thank you so much. Yeah, if you could put more info on that in the chat, we'll definitely watch that bill.
I mean, I don't know if
Okay.
anyone actually saw the definitions for sex that were on the White House. I mean, they were insane, right? Like, I just put them in the chat, but like, what does that even mean? I think this is one of the biggest challenges for us in all of this, is that there's a certain amount of just chaos and crap that we're going to have to deal with. And even, you know, like the White House throws out the OMB thing, and then later in the day, oh, that doesn't, we're not applying it to Medicare and Medicaid. We sorry, we didn't think of that. And you don't know, is it deliberate? Is it stupid? It's really challenging. You know, I saw in the note commenting on the work we're going to be doing, PNHP is going to be doing on Medicare Advantage. And we're taking a little quick pause and focusing on seeing what happens. You know, Project 2025 is talking about automatically enrolling people into Medicare Advantage. And so I think that's the biggest thing we're focusing on right now, is sort of talking about what's in there, talking about the plans that are being made. We're lucky enough that we have both the RFK and then the Dr. Oz hearings as opportunities to sort of, you know, raise the volume on the idea that these are proposed plans. And again, like, God, Elisabeth, that was just a brilliant table that you had of kind of, you know, all of the stupid plans they have all out there that are slightly different and just make it more complicated and just make it more confusing with a little bit of stupid mixed in that makes it, I mean, like several people sent me those definitions on sex and they were like, what does that mean, large reproductive cell? And I'm like, I don't know.
I was like, I wanted you to answer that. Is that a real thing? I've never heard of that.
I've been in practice for 25 years and no, I've never heard it. I don't know. I'm sure there's some obscure.
It's probably in the Bible.
No, I'll bet it's even weirder than that. I'm sure there's a place that we can find but I don't know. Stronger people than me will find the connections and actually, I mean, yeah, ova and sperm, but what makes one larger and smaller? And when exactly are they large and small? Like, you know, I mean, the whole conversation's kind of insane. Anyway, I only put it in the chat because I still haven't gotten over like how challenging it will be when we're working in this environment. Yeah, I like the idea that it's hand size. So I think for now, I think we're going to keep doing the work we're doing, which Senator Warren's putting forward a bill that's called Leveling the Playing Field, and that's to try to improve Medicare. And then we're going to keep talking about trying to keep the ability to choose traditional Medicare as a choice. We had a quick conversation with Sanders' team today, and he is talking about bringing forth the Medicare for All bill again and keeping it similar to how it has been structured before. And he's talking about doing it spring or summer, not completely decided. But so we will have lots of legislative issues that we can gather and fight on that are meaningful. And so I mean, I think we're going to have lots of room to talk, because I think we're going to be fighting this every single day as these issues come up. I don't know, Betty, if there were any other.
That was perfect. You actually answered a couple of questions all in one. And, you know, I think it's important to emphasize that we are fighting to protect our public health care infrastructure. We are fighting for Medicare for All nationally, and we're fighting for the New York Health Act. And these are not fights that conflict with each other. New York is closest to passing a universal health care plan of any state in the country. We have a majority of legislators in both our New York State Assembly and Senate who are committed to vote for the bill if it comes up for a vote, but at the same time, we're fighting nationally. All right, so with that, I'm going to thank you so much to all our panelists. That Q&A was really informative on so many fronts. We will pass it next to Morgan to take us into our calls to action.
All right, thank you, Betty. Okay, I'm going to try to keep this brief, but all of these calls to action and links will go out in a follow-up email along with the recording for tonight and the slides for tonight. So don't worry if you miss something. We'll also be dropping the links to these calls to action and upcoming events in the chat. But if you don't capture it, don't fret. We'll definitely send it out and follow up. All right, so the first item is from National PNHP. As Dr. Singh mentioned earlier, National PNHP is conducting a survey of physicians, inviting them to share their experiences regarding the financialization of healthcare. That survey is available on National's website. We'll drop a link for that in the chat. Let's see. The next call to action is to invite healthcare workers to join New York Doctors Coalition Immigration Working Group that just formed on Signal. It's if you use the Signal app, you can request to join that working group through either this QR code or the link being dropped into the chat now. And someone will address your request to join once it pops up there. If you are not on Signal and want to participate in the New York Doctors Coalition calls, those happen every Sunday, and we can include a link to that. I don't think we have that available right this minute, but we can include a link to that in our follow-up materials in case you're not on Signal. All right, the next action item is to contact your New York State Assembly members and state senators and ask them to either co-sponsor the New York Health Act if they're not already a co-sponsor, or ask them, if they are a co-sponsor, to work to pass the New York Health Act and to get our leadership to bring it to the floor for a vote. That's kind of where we're stuck in the state legislature right now, in both the Assembly and the Senate. We want it to move through committee and get to the floor for a vote. As has been mentioned earlier this evening, we really think, you know, this is one of the most substantial ways that our legislators can help protect New Yorkers from attacks on healthcare at the national level. It would save the state and save over 90% of New Yorkers money compared to what they now spend on healthcare. So the time is of the essence, and we really need to improve our New York State legislators to move this bill forward. And lastly, as far as the calls to action go, we would love to have you share your healthcare story with us. We'll really win with the power of our stories. Stories are memorable and they move us and our legislators in ways that stats and data really do not. Our stories help build solidarity and understanding. They allow us to see how our different experiences are interlinked. And as we've seen in the last couple of months after the killing of the United Health Group CEO, with the incredible outpouring of stories from people on every social media platform and in the comments section, of basically every article related to healthcare, people are sharing their stories and bonding, and the stories really give us clarity about the systemic injustices that we're all up against, and they help bring people together and bring them into the movement for universal health care. So please do consider sharing your story with us. We would love to feature them in our Med Story Monday series, and we use them in our lobby days and in testimony during rallies and public hearings. So really countless ways that your stories are helpful to the movement. And now to go over a few upcoming events. The first is a New York Lawyers for the Public Interest training that's happening tomorrow morning at 8 a.m., 8 to 9 a.m. That's tomorrow, Wednesday morning at 8 to 9 a.m. And it'll be on creating safer medical spaces for vulnerable immigrants in New York State. The training will specifically cover how healthcare workers can navigate ICE enforcement in healthcare settings and can help patients who are more at risk feel safer in medical settings. It'll also cover how doctors can advocate for policies within their institutions to ensure that communities feel safe accessing care. And it will include a basic Know Your Rights training as well. So the link to that will go into the chat and again be sent out in follow-up. That one we might not get this follow-up email out in time for that. So if you save anything, please do save that link if you're interested in attending. And again, that is for healthcare workers. All right, the next, this is open to anyone. National PNHP is hosting a series of legislative visits opposing Medicare Advantage. So Medicare Disadvantage is what we call it. And you can join them for meetings in January and February to meet with legislators and share why we oppose Medicare Advantage and the general privatization of care. You can learn more about that on National's website, and that's where this RSVP link will take you as well. All right. The next action is from National PNHP. They'll be holding a shadow hearing for Dr. Oz's confirmation hearing. We don't know the date for that yet, but you will be able to watch live as physicians, nurses, healthcare professionals, and seniors warn Congress and the American people about Dr. Oz's plans for Medicare. That date, when it's announced, if you register at this link, you'll get a notification about the date as soon as we know it. And we expect it to be held either in late January, which there's only a couple more days, or early February. So keep an eye out for that information soon. All right. And for our PNHP New York Metro chapter, we are beginning a series of new member interest sessions, and we would love to invite all of you to join our first and next one on February 13th at 7 p.m. The link to that will go in the chat. If you have been a long time attender of our forums and have been interested in getting involved, this is a great place to go and get more information about our working groups and how our organization is structured. Or if you're completely new to our organization, we invite you to come and find out more and try to get you plugged into the organizing that we're doing. Let's see. All right, and as was announced earlier, we invite you to join us for our February 18th forum on pandemic preparedness, public health, and putting people before profits. We'll be dropping the link to RSVP for that in the chat, and there will be more information, including speakers for that in the coming weeks. And last but not least, for upcoming, it's not advancing for some reason. There we go. Last but not least, save the date and RSVP for our health worker, resident, student, and advocate lobby day that Betty mentioned earlier. That will be on Tuesday, March 18th. It'll be an all-day event. We're doing it in person in Albany, so there will be a bus going up from New York City, and we'll be organizing carpools from around the state to bring folks to Albany for that. We will also be having a lobby training and a New York Health Act 101 on Thursday, March 13th in the evening. That'll be 7 to 9 p.m. And there will be some time to practice for folks who have not lobbied before, or if you need a refresher. So that the same link to register for the lobby day, you can also register for the training. And that is it. So Betty, I'll turn it over to you if you want to talk us through the breakout group process.
Thank you so much. All right, so we're going to have a number of breakout groups so that we can continue our organizing conversations and commit to take action. So our groups will, that you can choose from, there's going to be a New York Health Act 101 group led by Dr. Ollie Fine and our student fellow, Zach Gallen. So you can ask your New York Health Act questions there. We will have our racial justice and immigrant justice breakout group, and this connects to our anti-racism working group, which will next meet on February 8th at 11 a.m., led by Dr. Runa Ray and Yuling Kosu. Another group will be outreach and education. So this will be targeted at healthcare and the community at large, outreach about the New York Health Act and Medicare for All. So you can go there and think about spaces, groups, other places where we can do outreach, and that will be led by Dr. Ashley Duyan and our student fellow, Jen Sujijanto. We will have a communications breakout, so that will focus on graphic design, social media, and writing about the New York Health Act and Medicare for All, and that will be led by Morgan and our board member, nurse Katie Season. And finally, we will have a group focused on legislative work, particularly for the New York Health Act, and actions that we can take to promote the New York Health Act. That will be led by me and the State Legislative Advocacy Working Group co-chair, Anthony Cheesebro.